Hello, namaste. This video is on type 1 diabetes and thyroidism. Recently, we have done a video on type 2 diabetes, and then some people made a comment they wanted to know about type 1 diabetes, and it was already in the pipeline. So I thought it's a good time to make a video on type 1 diabetes and also on thyroidism, particularly hypothyroidism. Now, one thing which we need to understand is this, that type 1 and type 2 diabetes are completely different diseases. Although they affect the blood sugar, that is one part, but how they happen, what they do, it's completely different thing. Type 1 diabetes happens more in the young age, and somehow it's happening little more to the girls these days. Whereas type 2 diabetes, it happens in the middle age or later in the age, and the type 2 diabetic persons would have normal insulin being formed there. There could be some other issues that insulin is not able to do the task which is supposed to do. Whereas in type 1 diabetes, your own immune cells somehow destroy the beta cells of the pancreas. See, little more explanation about the diabetes, type 1 diabetes. We have a gland known as pancreas, and pancreas is responsible for making many enzymes and also hormone, the insulin hormone. And the particular kind of cells that make this hormone are known as beta cells. And these cells would make the hormone called insulin. Now, insulin is very vital in the cellular uptake of glucose. If you don't have insulin, then you will not be able to utilize glucose, and glucose is our primary energy source. So I mean, no life is possible without insulin. That's why insulin is so much necessary. And that is the reason when anybody is diagnosed with type 1 diabetes, he or she is usually supposed to be taking insulin rest of the life. Now, coming to the thyroidism, hypothyroidism. Now, hypothyroidism is affecting many people, and there are many people, and I feel again that this is happening more to the girls and the ladies. And many people are now regularly taking the thyroxine pill, which is a kind of a hormone which you take orally. Now, the difference in the insulin and the thyroxine is this, that thyroxine could be taken orally, but insulin so far cannot be taken orally, so it has to be taken through an injection or a pump only, though there are some experiments going on to make the administration of insulin easier. Now, the complication with the insulin is this, that the insulin is very dangerous also. So you cannot have more than a particular amount of insulin being injected to your body. It actually is lethal. If a lot of insulin is injected to anybody, the person would die. And in some countries, the insulin injection is actually, or probably in the past, been used to give the capital punishment. Because what happens when a lot of dose of insulin is administered to anybody, the person goes in coma and dies. Thyroidism is affecting to many people, and earlier it was thought that there is a connection between the iodine deficiency and hypothyroidism, and that is why it was made mandatory for the salt to be iodized so that people can receive a regular dose of iodine. However, despite all the salt having been iodized, the occurrence of hypothyroidism hasn't gone down, but it has gone up only. And now it is being realized that hypothyroidism is primarily again an autoimmune disease. The commonality in thyroidism and type 1 diabetes is this, that both of them have a hormonal connection. The thyroid is a major gland in the body and produces hormone and is responsible to the growth, temperature regulation, and many things. Likewise, type 1 diabetes also have a hormonal connection, that insulin is involved in this. In both of these diseases, there is autoimmune connection, that the disease is caused by an autoimmune condition. And also there could be some involvement of the gene switching also. Gene switching could be particularly more relevant to the thyroidism, and this can have an important role. So far as our experience at the Sehatvan is concerned, we have lot many people with hypothyroidism have stayed there. Now, you might be knowing many people around you having thyroid issue, people taking a small pill every day in the morning, empty stomach. And the major symptoms of thyroidism are weight gain and mood swing. So these are the main symptoms, although there are many things because it's a major gland and it affects too many things. So we have many people with thyroidism have stayed at Sehatvan, and we feel that thyroidism is actually not a difficult condition to reverse to. You can reverse it through forest fasting quite easily. Because when you go for forest fasting, then your gene switching becomes balanced, and also your immune system gets rebooted, and because of that having gone rebooted, that it becomes more smart, it becomes more sensitive, and then it acts more accurately. Now, we as such don't have much experience on type 1 diabetes because not many people with type 1 diabetes have come here, just few have come. And we have been, it has been possible to suggest them some lifestyle measures which can otherwise strengthen their health, number one, and number two, it has been possible to reduce the doses of insulin. But we feel that if we really do some deep experimentation, then it could really be possible to figure out something much better. And I'm particularly keen in having here people having type 1 diabetes because I feel that a particularly prolonged stay in a forested area, of course, type 1 diabetic persons cannot go for autophagy. Autophagy could be very dangerous for them. But I feel that just by staying in a forested space like Sehatvan and having more monitoring of their health might actually in some way may lead to some improvement in the disease. And we are actually keen in having people with that problem to come here. It's a kind of my personal invitation to those people. Next month from 1st October, actually we are planning to have a particular bracket for women only, say 3 weeks bracket where we would be extensively utilizing or working with the biohappiness approach of ours and also of forest fasting, and we are inviting women and girls to come here and stay here for 1, 2, or 3 weeks, and we hope that many of the lifestyle issues could be addressed upon. There is one more point I like to add here, is this, that why it is important to work on these conditions, because these are autoimmune. And so I would say look at from two viewpoints. One is this, that if you have a disease, it's really good to get rid of it. Number two, even if it is very difficult to get rid of that disease, it's always good to strengthen your health so that that your all other things are working in a better way and you be able to deal much better with that disease. And particularly in this situation, my pointer is towards the autoimmune, because these are the autoimmune diseases. So it would really be nice to balance the immunity, because if immunity is not balanced, then the autoimmune situation may actually go to some other place also and may cause some other problems also. There are many autoimmune diseases coming up these days. So if you are not too busy, I like to suggest that take some time for yourself and join this retreat from October 1, which is being announced particularly for women. Hello, my name is Vipin Gupta and I like to know your views on this video. If you like the video, please consider subscribing and sharing. Thank you.